it. So just wanted to let you know if that's a sensitive topic to you, we will be digging into that or some of that today. And I think now I'm going to turn it over to Darian to just say a quick hello and share a little bit more about the Environmental Stewardship Advisory Committee that's putting on this discussion.
Sure, I'm happy to, Jen. Thanks. So for those of you who may not know, AISD has the Environmental Stewardship Advisory Committee, also lovingly referred to as the ESAC. It has 41 members, and it's a district advisory body that seeks to engage AISD students, staff, parents, and the community members in advancing environmental education and sustainable operations that enhance learning and support resilient, healthy, and equitable school communities. It's a very busy and engaging group. It started in 2008 and became a formal district advisory body in 2013. And the committee was instrumental in the board adoption in 2011 of the environmental sustainability policy, which is what a lot of our district work supports. And it's since advocated for staffing and programming, also actively creating opportunities like this webinar today. And over the years, they've also written letters of support for the Good Food Purchasing Program, which AISD has since adopted in our food services department, for expanding equitable access to outdoor learning opportunities and public use of green space, and a letter advocating for heightened considerations for air quality in schools near major roadways, not so unlike what we're here to talk about today. The ESAC currently has one position open for a teacher, so please feel free to share the application link. We'll share the website in the chat for you. Share it with an educator you know, or apply yourself if you're an AISD teacher. So thanks everybody for being here today. And especially thanks to our hosts, Jen and Eileen, for convening.
I'm going to turn it over to Darian.
The ESAC currently has one position open for a teacher, so please feel free to share the application link. We'll share the website. I think there's some replay happening a little bit. Does anybody else hear that? Okay, I'll keep going just to wrap up. Thanks so much for Jen and Eileen for convening today's conversation. And I'm going to hand it back over to our co-chair, Jen, to introduce our speaker.
Thanks, Darian. Yes, and I guess we should have done a little bit more introductions as well. I missed it, Darian, if you mentioned you're the sustainability director for AISD and staff support for the ESAC. I am one of the co-chairs of the ESAC for this year, and Eileen and Amanda and Mo, who are all in the line with us, are all ESAC members who helped put on today's discussion. So now I'm going to introduce one of our guest speakers today, Dr. Pavel Mishdal, who's an air quality researcher and assistant professor at the University of Texas Department of Civil, Architectural, and Environmental Engineering. Dr. Pavel's lab is leading novel air quality measurements, both indoors and out, again, that ambient piece, in order to better understand the factors affecting human health. So Dr. Mishdal, if you would just kind of get us started, help us introduce some of these concepts, and then we'll open it up for Q&A with our other panelists.
Should I start sharing the screen?
Yes, please, that would be great.
Okay. Great, thank you so much for having me. I'm extremely excited to tell you a little bit more about indoor and outdoor air quality, how they differ, a little bit about the myth busting aspects. And I am the director and founder of Air Quality Sniffer Lab that deals with these questions. And let me start telling you why we actually need to care about air quality. So if you think about it, for example, we need 1 kilogram of food per day, and we can survive about 1 month without food. Similar thing with water. We drink 3 kilograms of water and can survive several days without it. But if we think about the air that we inhale, that we breathe in, we inhale actually more than 10 kilograms of air per day. And we cannot refuse to breathe air for more than 1 to 2 minutes, no matter how polluted it is. So this is why we should really care about what kind of air quality and what we inhale, and especially about the indoor air, because we actually spend 90% of our lives, 90% of time we spend indoors. So air quality belongs to the top, air pollution belongs to the top leading global health risk factors. And 3 of them are from air pollution, and exposures to air pollution occurs predominantly indoors. So let me start from a few different questions so you can keep thinking about those questions, and hopefully we will get some answers throughout this presentation. So first of all, do we understand all factors that affect human health? And then another question is indoor air or outdoor air more polluted? Should we keep our homes and schools ventilated or maybe closed up? And what other ways to reduce chemical exposures? Can indoor plants remove pollutants? So just a few questions. And I want to mention that historically, like in long time ago, the air was much more polluted outdoors. And since the Clean Air Act, the air pollution improved, and actually the air quality outdoors, and actually it's great in many cities in the US, in Austin. If you compare, for example, 30 years ago and now, the visibility has also improved because the particles decrease. The catalyst on the automobiles and cars are removing NOx, nitrogen oxides, which then play a role in smog formation. So that's really good news. If we look at the graphs, a lot of pollutants have decreased. But there are still some issues, like some communities live close to industries, close to different pollution sources, such as different plants, different industries, and basically many times the communities are wondering what's in that smell, because if you can smell something, that actually means that there are chemicals. We smell chemicals. Those volatile chemicals go to our nose and we can smell them. And the question is it toxic? Is it really bad? And it really depends, because our sense of smell is not quantitative. It gets saturated very quickly. You can quickly tolerate some bad smells. For example, if you have heated asphalt, you can smell there's asphalt, and some of those compounds emitted, they are not very healthy. And I will tell you a little bit more about toxicity. But what I want to point out first is that not the compound, but the dose makes the poison. So it's the famous Paracelsus quote, sola docet facit venenum. And that actually means that, well, you can have some really toxic compounds, but they can be unabundant or they can be highly abundant. So it can span many orders of magnitude for many different chemicals. And for example, acetic acid, which we have in vinegar, it's usually very abundant, but it's not so toxic. And then on the other hand, you may have something that we cannot even detect in the air, and it might be toxic. So these compounds span abundance, reactivity, so lifetime, toxicity, and our level of understanding is actually skewed towards more abundant and least toxic. So now we have better technologies. And one thing I want to point out is that the air quality outdoors is not everywhere the same. It really depends where you are. If you live close to the airport or close to the different industrial sources. And so in my lab, we were very interested to map out these different zones of air toxics and odors chemicals. We have really state-of-the-art great tools in my lab, and we have also an electric lab where we can like put the mass spec, which we called the sniffer, which can see more than 1,000 of different chemicals that we couldn't see earlier. And it's really fascinating because you can understand what kind of sources contribute to air pollution. We have also UT Test House, where students really enjoy doing some cooking or spraying different consumer care products and see actually how indoor pollution changes. So this is the sniffer that we are lucky to have at UT Austin, and it's in my lab. And I will skip some technical detail, but just to let you know, it's real time. So every second you can see like more than 1,000 of different compounds. And now I want to basically change gears a little bit and tell you about indoor air pollution that we know much less, but we spend 90% of life indoors. So if we have a lot of cars, a lot of different pollution sources outdoors, that's not an ideal situation. But the nice thing about outdoor air is that the atmosphere is enormous. The volume of the atmosphere is really, really huge. In terms of our indoor spaces, the volume is much smaller. So let me start from so-called the Corsi code. You were probably wondering what those numbers mean. Maybe you have already guessed what they mean, and I will decode it for you. So these numbers mean a number of years. So there is 79 years is average life expectancy in the US. And out of those 79 years, we spend 69 years indoors. That's amazing. 54 at home, 26 in bed, 4.3 years in vehicle on commute. And so it's only 6 years outdoors. And we ourselves create pollution. It's not only breath and metabolic products, we also, our skin have reactive compounds that react with ozone. They have double bonds, for example, squalene. And there is a lots of chemicals we put on ourselves, creams and other consumer care products. And there are microbes that live on us. Not all microbes are bad. Some are actually beneficial, and they can emit different compounds. So I want to say that what is happening indoors is very complex, because in addition to what is coming from the outdoor air, we also have a lot of other sources. So ventilation seems very important because this brings down the level of pollutants indoors, and the volume of space is important. So just to let you know, I will show you some cool research, recent studies from Southeast Austin, because we have one of the project, Southeast Texas, where the pollution, outdoor pollution, is very high generally, and much higher than in Austin. So this house, and there is one female participant and a cat actually living in this house. So what we were doing was switching between it's a real-time mass spec, real-time sniffer, so we could switch between outdoor and indoor air and could see what is happening. So this is a very complex graph, like some, but just to let you know, the larger the circle, the higher the concentration of the compound, and all the compounds you see below this dashed line are more abundant indoors than outdoors. So what you actually see is that actually indoors is outdoor plus. So some people think that the pollution is outdoors and indoors we are safe. Well, it's outdoor air will penetrate. So the pollution is on top of this outdoor air. And some of these compounds are like orders of magnitude more abundant. But sometimes you may have a plume, you may have a forest fire or biomass burning plume, and this changes the picture. So, for example, this is a variation over time of a compound called furan. This is a biomass burning tracer. And when there was biomass burning plume arriving, you can see it's an enormously high concentration of furan. If I zoom in here, you can see that the house was closed up, the windows were closed, the doors were closed, and this outdoor pollution was penetrating very, very slowly. So actually closing up with the windows and doors is sometimes useful when you have like a major pollution event. But in general, it needs to be ventilated because in general, we have much higher concentrations of pollutants indoors than outdoors, and it's outdoors plus. So there are chemical pollutants, but there are also some microbial pollutants that were measured by my collaborator, Kerry Kinney, who is in the same department. And we found that surfaces are covered by microbiomes. So it's good to clean those surfaces indoors. We also have low-cost sensors that can be put in people's homes, and communities can track how this pollution changes. And another cool thing that the community can do, and each of you could actually think of doing, is to build an affordable indoor air filter. There are some filters in the shops as well, but the nice thing about your own filter is that it's affordable and also it can be very efficient. So we tested some of these. If you're interested, I can show you later because students built a lot of those filters, which are very easy to do, and they are efficient. You can see from the data as soon as we turn it on, the level of pollutants decreases. So this exposure, this chemical exposure, how much we get exposed to pollutants, which may affect human health, it's basically this area under the curve. If you, for example, inject some disinfectants to non-ventilated indoor space, you will have a huge concentration and then it will be decaying. So this area under the curve is your exposure. So what I'm showing here is the model, and look at this area under this curve is huge when you have very low air exchange rate. If the house is not ventilated, it's huge exposure. But if we open the window, for example, and we cannot open the window all the time because in a city like Austin, you need to have air conditioning. But we can, for example, ventilate after cooking event, after cleaning, can open the doors and windows, and you can see like this kind of ventilation can quickly remove those pollutants, which otherwise we would be inhaling. So huge effect of ventilation on reducing exposure. We also have a mannequin who we called Steve, had the project during the COVID when we actually studied the effect of masks of exposure to disinfectants. And so we put the mask on Steve, and this is not just a regular mannequin. It is equipped in breathing, so it exhales and inhales exactly the same like we do. So we're doing this disinfection experiments, and we found that actually initially the masks decreases exposure to disinfectants, but later on it reverses. So because these disinfectants will be reacting on the mask and generate. So if you do cleaning with the mask, get rid of the mask afterwards. And we have amazing facilities at UT Austin. If any of you would like to visit, we would love to organize a tour. And here's like the HVAC system where we can test different filters. And for example, this is the picture of one filter that is extremely efficient. Sometimes it's compound specific, and this filter removes, not all the filters are so good. And just one final thing, I know it's kind of close to the end of my time, but I want to say that combustion creates enormous amount of pollutants. We actually, in collaboration with City of Austin and firefighters, we were able to look at the impacts of the house fire on air pollution. But you can also think about other types of combustion, such as cooking, unvented fireplaces, and like in this particular home, there was a car, there was an EV car, right? So we wanted to see what is happening if the battery will explode and so on. But okay, so I asked you some questions in the beginning, and now we need some answers. So let me give you some take-home messages and wrap up. So it's not the compound, it's the dose that makes the poison. Indoor air is typically much more polluted than outdoor air, especially if it's not ventilated. So we need to limit number of chemical products brought indoors and try to increase your outdoor to indoor ratio. Like now we have a very nice weather, so it's good to spend a lot of time outdoors actually. Dilution is the solution to pollution. So this is if you ventilate, maybe not all the time, but frequently, especially after cooking and cleaning, that can reduce your exposure by a lot. Air filtration and source control can be effective. Build your own affordable and effective cleaner, for example, Corsi Rosenthal box. And then finally, for example, I love plants, I love flowers and so on. So they are great to have indoors, but they might not solve the pollution problem. It still needs to ventilate and use air cleaners. They do remove a little bit of pollutants, but they also generate some compounds. So it's important to ventilate. So with that, I would like to thank a lot of people and collaborators, and thank you for your attention. Just let me know if you have any questions.
Thanks so much, Dr. Mitzel. We really appreciate the invite to your lab. I sort of see the seeds of a field trip in the future. So just to kind of let y'all know, we're going to be transitioning now from Dr. Mitzel's overview talk into a moderated Q&A. And my name, by the way, Jen mentioned at the top, is Eileen McGinnis. I serve on the ESAC, and I'm also an AISD parent. So we're going to continue to get to talk to Dr. Mitzel and ask questions, but we're going to also expand the number of voices that we're including in the conversation. So it's my pleasure to introduce the rest of our panel today. We're going to be also talking with Jacob Barrett, who is the Transportation Demand Program Manager with the City of Austin. Jason Hawkins, who is Director of Facility Maintenance at AISD. And Ramon Zarate, an air quality specialist with, I'm probably going to trip up on this, the Capital Area Council of Governments, or CAPCOG for short. So with that, let me turn things over to my colleague on the ESAC, Mo, for the first of our pre-scripted questions.
Sure. This question is for Ramon. Can you give us a quick snapshot of the state of air quality for Austin? And then also, how do the new EPA regulations for vehicle emissions announced this month play a role?
Thank you so much. I just want to do an audio check real quick. Everybody still hear me okay? Okay, perfect. So for giving a quick snapshot on the state of air quality, I want to kind of give it from a regulatory perspective, because, as we just kind of discussed, depending on where you're at, you might have, a different sort of view of air quality levels where you're at, comparing East Austin to West Austin or something like that. So from a regulatory perspective, as most of us might be aware, the EPA recently updated the annual particulate matter 2.5 National Ambient Air Quality Standard, or we call it NAAQS for short. And the Austin area now falls out of compliance with that standard. Currently, the Austin area is at high risk of being designated non-attainment status by the EPA for particulate matter 2.5. So that means that the EPA sets a level for what PM 2.5 pollution should be at for a region, and we're now currently above that based on that new standard. And we're also currently out of compliance with the ozone NAAQS as well. So we've been under the levels for the EPA for a while with ozone, but here recently this past year we've just gone over for the ozone standard. The Austin area has never been designated non-attainment status before. This would be new for us, and CapCog estimates, or we made this estimation back in 2016 for ozone, but we estimated that non-attainment status could cost the region anywhere from 24 to $39 billion over the next 30 years, just due to various situations that we would go under for trying to get back into attainment status. And then regarding that new EPA regulation for vehicle emissions, in terms of regulation here and everything, this new EPA regulation would most likely not help to prevent non-attainment designation for PM 2.5 in Austin, but it would probably be helpful in coming back to attainment status in the future. So kind of looking further a couple years down the line, that that new vehicle emission standard is going to be helping us in the future.
All right, thank you.
Mhm.
Go ahead and ask the next question to Dr. Meitzel. So you talked a lot about indoor air quality and outdoor air quality, and my question is, like, who is impacted the most by air pollution and why?
Well, actually, we all are impacted in a certain way, especially because we spend 90% of life indoors. And Raymond embraced nicely this regulatory perspective. Currently, indoor air is not regulated, and the city of Austin is generally very clean. But I want to say, like, it really depends where you live. And so basically, yes, if you live close to those industrial sources, they will be penetrating also indoors. And I think kids are quite a group of community who get impacted a lot, and especially like indoors, there's a lot of papers about exposure of toddlers to chemicals in carpets, for example, because they crawl on the carpet, and it's, you know, some carpet may contain, for example, PFAS, which are perfluorinated alkyl substances, which EPA also are aware of. And now we have like new generation of carpets, some green carpets as well, that do not have PFAS. And actually in California, in San Francisco, you cannot buy carpet with PFAS. PFAS is often used as a, yeah, so this is just an example, but there could be a lot of other compounds, flame retardants or plasticizers that are commonly used indoors, and they will affect community. And I think we should care about outdoor air pollution. Is much easier to regulate. One aspect why it is not so easy to regulate indoor air is because people don't like to be told what to do in their backyards and so on. But we should actually care for ourselves to try to reduce exposure to indoor air pollution.
I feel like that question is a nice segue to speaking with Jason at AISD. And I'll try to limit myself to just one question for now, so we have more time for audience questions, but we'll circle back to my other question later. So Jason, if you could give us like just a big picture overview of how AISD is measuring both indoor and ambient air quality in or near school campuses, as well as, are there ways that students, parents, guardians, and/or staff can get involved in that monitoring?
Hi, so AISD's indoor air quality monitoring, we have in a building automation system, what we are monitoring right now. Both one sensor for every campus for outdoor, measuring temperature, humidity, and then multiple systems inside per space in a lot of places, measuring CO2, humidity, temperature. And we're trying to integrate our systems so that not just monitoring, but reacting with the equipment and ventilating some of this indoor air quality issues out of the schools as it's happening. one thing I would say that's different about a public school system comparable to your house is that we do have fresh air systems, ventilation systems hooked to our air conditioning systems at all times, and they're designed to work with the air conditioning systems so that as some of these indoor air pollutants rise or fall, then the fresh air requirements are raised as more people come into a room or pollutants are detected and ventilated, and following the ASHER standards of ventilation rates per hour per space. And as for what people can do to get involved in monitoring, we are working with the district to set up more collaboration between the community so that they could see some of these systems that were set in place. We don't have that all put into place right now, but it is something that we are very focused on and looking forward to in the future.
Great, thanks.
All
Mike.
right.
Just gonna say, I think before we go to our last question from Mo, I just want to check in with our audience. I know I'm now able to use the chat, but I'm not sure if everybody else is. So are there any other kind of questions from the audience? We want to make sure that we make room for those as well. You're welcome to raise your hand. We'll be able to see that, and we can unmute you. Or you can drop your questions either in the Q&A or in the chat. Either one will work.
All right, perfect. And then my question for Jacob is, what can I do to have the biggest impact on improving outdoor air quality?
Sure. So switching to outdoor air quality, I think that's the most visible form of air quality concerns that many of our communities see, with queuing lines of cars dropping off and picking up students. So what can we do? Well, we can do something different some of the time other than drive alone. And what does that mean? Well, if you can walk or bike your student or yourself to school one day a week, that's great. If you can take transit, if you can carpool, if you can even take a scooter or something other than driving alone one day a week is the biggest thing that we can ourselves do. To just throw out a number here, the percentage of students walking or biking to school in the United States peaked in 1969 at 42%. In 2017, we were at 10. So we've really seen a huge shift in our communities, walking and biking to school, even busing to school, taking transit to school. And the biggest thing that we can do is reinforce that culture with ourselves. And we've been making a lot of investments in Austin with our active transportation network, with our transit network, that we're trying to bring that culture back and really make our infrastructure more comfortable for folks to walk and bike, to take transit, to carpool to school. So that's the biggest thing that we can do. We have examples of communities that have done it. Portland is a great example. In 2006, they were at about 30% of their students walking and biking, and they're on track to exceed 50% by next year. So we know that is possible. We really just need to reinforce it with our communities.
Awesome, thank you.
Jacob, I just have a quick follow-up, and then I know there's also some trouble for attendees to ask questions in the chat, but I just wanted to follow up about what you think, what's happening differently in Portland, for example, that, you know, what are the changes that are being made or the incentives that are getting those numbers?
That's a great question. So one thing that Portland does is they do have a really robust Safe Routes to School program that's funded through their gas tax. And it really has put active transportation infrastructure in neighborhoods, in investing in people getting to their homes, to and from schools. The other piece that we are really trying to bring to Austin is they do great walking and biking school buses. And it's a community-wide effort where individuals at campuses, it can be a teacher, it can be a PTA, it can be parents, just choosing to say, I'm going to be at this intersection at 8 a.m. every Wednesday morning. Any student who needs to get to campus can come and walk or bike on this walking or bike bus, and they will have a parent or an adult to accompany them on their way. That's something that we're really actively trying to instill at our campuses, and we're looking for folks who are willing to participate in those efforts. So please, if anyone is interested in doing a walking or a bike bus, reach out to me at the city, and we would love to get a conversation going.
And Jacob, I think that's a great intro to another question we had from Melody Alcazar in the question and answer. We understand that y'all aren't able to use the chat function, so you can drop your questions in the Q&A or raise your hand and we should be able to unmute you. But Melody asked that walking and biking to school sounds great in theory, but isn't always practical. So you touched on some ideas for how to make that more practical, but can you introduce, you or any of the other panelists, share any other ideas about how the district and the city can work together to improve safe routes? And do we have funding already allocated to this?
Well, I'll kick it off, and then anyone on the panel can please jump in. But we do have a robust bond that was passed back in 2020, and we're really making some significant investments in our active transportation network. So that's the infrastructure piece. The other piece is, if it isn't feasible for you to walk or bike to school, if you're more than 2 miles away, there are other options. Carpooling is the number one that I would suggest. We work with an organization called Movability, and Movability is actually working on a school pool program where campuses can have their own network of carpools, where a parent can pick up multiple students and take them to and from campuses. And that really helps cut down on the commute congestion around campuses and those queue lines, but it also helps improve our air quality because we're ultimately reducing the number of vehicle miles traveled on our roadways and the vehicles getting to and from campuses. Also, don't forget, students ride for free on Cap Metro. So if you're commuting on your way to work, and you can take a bus route on your commute, you can drop your student off and they can ride free with you on the bus. So that's also another huge benefit that I would recommend.
Thanks, Jacob. Any of the other panelists want to add to that?
I'm ready just to ask questions.
Great.
I have one. If I know we're officially opening it up to everyone, right, to ask questions officially, if it hasn't been made official yet. I had a question for Dr. Meetzel. You had a slide where you showed a map of Austin and you were talking about air quality. And I don't know if you can bring that slide back up or not, but I was just curious because it had like different colors on the map. And I think I looked at the unit and I thought it said something about percentile. Is that something you remember and you can speak to and explain?
Yes, thanks. So I want to say that the map I showed it was basically the NATA respiratory. So this is basically, we have a lot of health data, and we know that certain groups of people, for example, have more asthma events, for example, and we study collaboratively also with Dell Medical School factors that affect triggering of asthma events. So we know that there are some pollens, but there's also increasingly known that some air pollutants can also contribute. And there's a recent nice paper by Elizabeth Matsui about that. The point I want to make is that when we think about the distribution of pollutants, it's not static. It's not like you are in one place, it's always bad, because the pollutants, they change at night, they change during the day. It's spatial-temporal variations is kind of high. So, for example, at night, usually the volume of the atmosphere is smaller, the boundary layer shrinks, and more pollutants can accumulate. If you live close to the sources, sometimes at night you might smell some odors and so on. And during the day, it's more turbulent, so on. So yeah, the bottom line is we are trying actually to find the links between air pollution and human health. Luckily, Austin is pretty clean as we are not in non-attainment zone, and ozone PM 2.5, it's very good. Try to understand also some unregulated and some other chemicals, also in collaboration, and we are very happy to collaborate with TCEQ and CAPCOG and others. So yeah, this is my response so far.
Thank you.
Right, and if the audience has any questions, I don't know if we want to give it a shot to see if you can raise your hand if you do have questions and get those answered.
Well, we have another one in the chat from Kurt, or perhaps it's Daphne Hoffaker. It says, I'm a parent of an Anderson High School student. I'm very happy to hear that AISD is monitoring air quality inside schools. Any comments around the benefit of clean air for slowing the spread of airborne diseases in the classroom? For example, cold, flu, or COVID. And the air monitors, and are the air monitors in hallways or in classrooms? So Jason, I think that might be one for you.
So our building automation system that monitors some pollutants that build up inside the schools, the sensors are usually in classrooms, but those sensors regulate air handler units that also feed hallways if there's air conditioning in some of the hallways. Now, some of the older campuses at AISD don't have air conditioning always in all the hallways, but I believe Anderson does, and the hallways are fed off the classroom spaces. So, and these are some of the systems that we're looking to upgrade more than what we have now. So hopefully that will answer part of the question.
And Jason, just because you mentioned a somewhat technical term, the air handler unit, can you describe what that is?
So that would be the air conditioning unit. At Anderson High School, we have chill water, hot water, feeds each air handler throughout the school. And then we have outdoor air ventilation units that feed into the air conditioning unit, and the sensors that are in those spaces or the air handler unit itself would determine how much fresh air is needed, or how much fresh air that we can put in and still properly cool the space. So that's kind of limited on how much fresh air we can bring in and still properly cool the space at the same time. And during the pandemic, we went throughout the school district and tried to increase ventilation rates to the maximum percentage that we could while still providing decent temperature for everything. But before the pandemic and before some of this stuff arose, the theory behind air conditioning was to maximize energy efficiency 100%. And that's why all your air handlers would stop blowing and shut down as soon as the space temperature got to a certain place. But during the pandemic, we saw the need to maximize the ventilation and the air handler. And that really helped, I believe, get us through all that. And we continue to do that after, or still to this point.
And I can follow up on this briefly, is that what I was saying, that dilution is solution to pollution. It can be applied both for chemical pollution and microbial. So definitely ventilating can dilute chemical sources, but also can lower the number of infectious quanta which we use in modeling infectious disease transmission. So yeah.
Thank you. And I'm going to jump in because we have 3 minutes left. I see there's another question from Joe Guerra that I want to make sure we get to. So while I'm sharing that question and inviting somebody to respond, if the panelists, if you would also just love to share in the chat any upcoming events or ways that folks can take action to improve air quality at their schools and in their neighborhoods, that would be great. And we will follow up with everyone. We will compile all these resources for you and share an email out after today's webinar. So stay tuned for that, but I'm just going to close with one final question, again from Joe Guerra. What is the impact of indoor air quality on student or teacher attendance and their cognitive functions? Does anybody feel like they're up for starting to touch on that one? I know that's a deep subject, but any info y'all would like to share?
I can say that it's a very, very good question. There are a few papers that actually say that what we are inhaling also impacts cognition. There was a test which showed that students perform less well in polluted indoor atmosphere, especially on the tasks that require abstract thinking and are more complex. So definitely it makes sense to keep the air quality good in schools.
Thank you. Are there any other panelists that would like to share any resources or upcoming events or follow up on that last question?
In terms of resources, this is Ramon again from CapCog. I'll make sure and share. We do a monthly newsletter that's just like open to the public that usually shares events that are going to be happening that month and sort of different outreach resources. So if that's all right with y'all, I'm going to add that as a resource as well.
I also shared a tool from TCEQ, which can allow community to look up different air monitoring stations and can see how some volatile organic compounds, for example, measured by AutoGC, change. We are currently working on a dashboard in collaboration with Texas Advanced Computing Center to actually show some of our recent results. So please stay tuned. And also, as I mentioned earlier, we will be happy to organize tours for interested students and teachers to show the UT test house and some of the facilities.
That's so cool. Thank you so much. Okay, well, a huge thank you to all of our panelists and for all of you for showing up today and joining us live on Facebook and YouTube. We're so grateful for your time and all that you do in our communities and in our schools. As I mentioned, we will follow up with an email shout out. I know we've been dropping a lot of links for you in the chat. We'll compile all of that. You're also welcome to reach out to us at any time. We'll also make sure you have all the appropriate contact information in that follow-up email. And again, thank you for being here and have a wonderful afternoon.
Thank you so much.
Thank you.
Okay.
Thanks, everyone. Bye.
Thanks, everyone. Enjoy your afternoon.